Hello friends, and welcome to Dr. Ankur's Dental Lectures. I am Dr. Ankur Sharma, and in our first case vignette about traumatic injury in the mandibular region, we are going to talk about anatomical considerations of fractured mandible. We are going to discuss about 4 topics today. First, about the sites of fractures in mandible. Second, about favorable and unfavorable fractures. Third, about the importance of tongue fall in bilateral parasymphyseal fractures. And fourth, on the importance of lingual nerve while performing surgeries in the third molar region of mandible. Coming to the first topic, that is site of fractured mandible. Most common site of fracture in mandibular region is the condylar region, which forms 29.1% of the cases of fractured mandible. This is followed by the angle region, which forms 24.5% of the cases, followed by the symphyseal and parasymphyseal region, that is 22%, and then the body of mandible, 16% of the cases, followed by the fractures of alveolar bone, which form 3.1% cases of fractures in mandible. Ramus of the mandible, 1.7% of the cases. The coronoid percent, 1.3% of the cases, followed by the others, that is 2.2% of the cases. If we see, we'll understand that the fractures of the condylar process, angle, and the symphyseal and parasymphyseal region are the most common fractures of mandibular bone. Now coming on to favorable and unfavorable fractures. If a fracture in the body of mandible originates at the upper border of the body, somewhere near the first and the second molar tooth, and the fracture line runs backwards towards the lower border of the mandible, such a fracture would be a horizontally unfavorable fracture. This is because the two muscles, masseter and the medial pterygoid, both these muscles, they tend to pull the distal fractured fragment of the mandible upwards. Whereas if the fracture line starting from the same points runs forward to the lower surface of the mandible, such a fracture would be horizontally favorable because the pull of these two muscles would be counted here and they would not be able to dislodge the distal fragment from the medial fragment. So that is a horizontally unfavorable fracture and a horizontally favorable fracture. If we see the mandible from above, I want you to consider these two fracture lines and these two fracture lines. This is the medial pterygoid muscle which pulls inward. Now, what happens is that in case of this type of fracture, where the fracture line runs backward, in such a fracture, the distal portion is easily pulled inward by the muscles. Whereas in a fracture line that runs forwards anteriorly, this medial rotation is difficult, more difficult. So this kind of fracture would be a vertically unfavorable fracture, whereas this kind of fracture will be a vertically favorable fracture. So there is a horizontally favorable and unfavorable fracture and a vertically favorable and unfavorable fracture. Now further to this is the importance of the genioglossus muscle in the parasymphyseal fractures, in the bilateral parasymphyseal fractures. These are the two fracture lines in case of a bilateral parasymphyseal fracture, and this is the genioglossus muscle which arises from the superior genial tubercle and goes to the tongue till the tip. This is the muscle that stabilizes the tip of the tongue. In case of a bilateral parasymphyseal fracture, what happens is that this whole portion or segment becomes free, and therefore the genioglossus muscle is not able to fix the tip of the tongue at the place where it usually is, and therefore the tongue may fall back into the oropharynx and cause airway obstruction. Finally, coming to the role of the lingual nerve. If we see the internal portion of the mandible, the lingual nerve passes very close to the distolingual aspect of the mandibular third molar tooth. Therefore, whenever we are extracting the third molar tooth, either normally or surgically, we should see that we do minimum trauma in the distolingual area so that we can preserve the lingual nerve. So this was regarding the anatomical considerations in the fracture of mandible. I hope this lecture was useful to you. You can give me feedbacks as well as subscribe and follow me at Facebook and at my website www.dentallectures.net. Thank you and bye-bye.